Dengue fever versus malaria. Understanding the differences. Dengue fever and malaria are two common but serious diseases caused by mosquito bites. Although both are spread by mosquitoes and can make people very sick, they are caused by different germs, have different symptoms, and need different treatments. Knowing how they differ can help people get the right treatment and take steps to protect themselves and their families. Let's break down the main differences in simple terms. 1. Cause and type of infection. Dengue fever is caused by a virus known as the dengue virus. There are 4 types of this virus, DENV1 to DENV4, and getting infected by one type doesn't give full protection from the others. If someone gets infected again with a different type, the illness can be more severe. Malaria, on the other hand, is not caused by a virus but by a parasite called Plasmodium. There are different species of this parasite, and the most dangerous one is Plasmodium falciparum. Other species like P. vivax and P. malaria also cause malaria, but are usually less severe. 2. How the diseases spread. Dengue is spread by the Aedes mosquito, especially Aedes aegypti, which usually bites during the daytime, especially early morning and late afternoon. These mosquitoes breed in clean, standing water, like in flower pots, water tanks, and discarded containers. Malaria is spread by the Anopheles mosquito, which mostly bites at night, especially between dusk and dawn. These mosquitoes breed in dirty or stagnant water, like in puddles, marshes, and slow-flowing streams. 3. Where they are found. Both diseases are common in tropical and subtropical areas, including parts of Asia, Africa, South America, and some areas of the Middle East. However, dengue is more common in urban and semi-urban areas, while malaria is more common in rural areas, forests, and places with less healthcare access. 4. Symptoms. Both diseases cause fever, but the other symptoms can help doctors and patients tell them apart. Dengue fever symptoms include 1. Sudden high fever. 2. Severe headache, especially behind the eyes. Is pain in muscles and joints, often called breakbone fever. 4. Skin rash. 5. Nausea and vomiting. 6. Sometimes bleeding from the nose or gums, or easy bruising in severe cases. The fever in dengue often follows a biphasic pattern. It gets high, goes down after a few days, and then returns again briefly. Malaria symptoms include 1. Fever that comes in cycles, every 2-3 days, often with chills and sweating. 2. Chills and shivering, followed by fever, then sweating. 3. Muscle aches. 4. Tiredness and weakness. 5. Nausea and vomiting. 6. In severe cases, confusion, seizures, breathing difficulty, or coma. Unlike dengue, malaria fever typically follows a pattern of shivering chills, then a high fever, then sweating, and then feeling better. But this repeats. 5. Diagnosis. To confirm dengue, doctors usually do blood tests such as NS1 antigen test detects the virus early. 2. Dengue IgM/IgG antibodies. 3. Complete blood count, CBC, to check for low platelets and white blood cells. To diagnose malaria, the most common test is a blood smear, where a drop of blood is looked at under a microscope to find malaria parasites. Rapid diagnostic tests, RDTs, are also available and can detect malaria antigens quickly. 6. Treatment. There is no specific cure for dengue because it is caused by a virus. Treatment is supportive, which means doctors treat the symptoms. 1 paracetamol for fever and pain. 2 fluids to prevent dehydration. 3. Monitoring for warning signs, like bleeding, severe abdominal pain, or low platelets. Aspirin and ibuprofen should be avoided in dengue, as they can increase bleeding risk. Malaria can be cured with medicines called antimalarials. The exact medicine depends on the type of Plasmodium parasite. Common treatments include 1. Artemisinin-based combination therapies, ACTs, for falciparum malaria. 2. Chloroquine or primaquine for vivax malaria. If malaria is not treated early, especially falciparum malaria, it can become severe and even life-threatening. 7. Prevention. Since both diseases are spread by mosquito bites, preventing mosquito bites is very important. For dengue prevention, 1. Avoid mosquito breeding by covering water containers. 2. Use mosquito repellents and wear long sleeves during the daytime. 3. Use window screens and mosquito coils for malaria prevention. 1. Sleep under insecticide-treated bed nets. 2. Use mosquito repellents, especially at night. 3. In high-risk areas, some people may be given preventive medicine, prophylaxis. There is now a vaccine for dengue available in some countries, but it's not yet widely used and has specific age and immunity-related criteria. A malaria vaccine has also been developed and approved for children in some African countries, offering some protection. Conclusion: dengue and malaria are both mosquito-borne diseases that can make people very sick, but they are caused by different germs and affect the body in different ways. Dengue is a viral illness spread by Aedes mosquitoes during the day, while malaria is a parasitic disease spread by Anopheles mosquitoes at night. Recognizing the differences in symptoms, how they spread, and how they are treated can help people seek the right care quickly. Most importantly, preventing mosquito bites through simple measures like using repellents, removing standing water, and using bed nets can go a long way in protecting yourself and your loved ones.